Okay, Dr. Fazia, before we begin, please gather this equipment just to make your reflexes. Like you can put any pen for syringe, and for pear you can any paper. You can use any paper, and waste bin, any dustbin. That's it. Like 3 to 4
Okay.
things so that you can make your reflexes because you need to perform it.
Okay, just a minute. Okay.
You ready then? This is your task. Go through it again.
Okay, shall I start?
Yeah, sure.
Hello.
Hello.
My name is Pootia Shahid. I'm one of the doctors working here in the NHS. Are you James here?
Yes, I am, doctor.
Hello, good to see you, James.
Good to see you, doctor.
Thank you. I understand you are a third year medical student.
Yes, I am.
Okay. So how has your studies been going recently?
Well, studies are tough, but everything is going great.
Good. And how are the wards going?
Well, everyone is cooperative and everyone is helping me out, so it's great.
That's great. Okay, so I understand, James, you are here to learn how to administer a subcutaneous injection, right?
Yes, doctor.
Okay. So before we begin, how much do you know about it?
I do not know much about this subcutaneous injection. I just heard this name and just I want to learn this procedure now.
That's all right. I really appreciate that you are so keen to learn. I'm here to help you, and we can get it done. All right.
All right.
So, have you ever seen it being given before?
No.
Okay, no problem. And I don't expect that you have done one before as well, right?
Yes, I haven't done.
That's totally all right. You can get one done in the wards. Okay, so now let me tell you that subcutaneous injection is one of the method of giving medications to the patient, in which we give the medication into the fat that is present immediately below the skin. Am I making sense?
Yes, yes, doctor.
Okay, and do you know why do we use subcutaneous injections?
No. I guess it's for the heparin, but others I don't know.
That's great. Heparin is one of them, and we also occasionally use it to give warfarin. All
Okay.
right, and can
Mhm.
also give some painkillers in the terminally ill patients.
Okay, all right.
Okay, and James, it just to clarify, at any point, if you want me to repeat anything, or if I am going too fast, please let me know. Okay.
All right, doctor.
Okay. Do you have any idea about the steps of the procedure?
No, doctor.
Okay, no problem. So first of all, before doing any procedure, we have to take a consent from the patient. All right.
Okay.
And should be an informed consent. By that I
Mhm.
mean we should quickly inform the patient and about the procedure, and then we should take his acceptance that we can proceed further. All right.
All right, doctor.
Okay. And after the consent, you need to prepare your medication in the drug room.
Mhm.
Do you have any idea what is the checklist for preparing the drug?
No.
Okay, no problem. First of all, after confirming the name of the medication, you need to check the dose, all right?
Mhm. Okay.
And then you need to make sure that it's not expired. And please make sure that you have a witness. That can be any nurse.
Okay, all right.
Okay, to be on the safe side. And then you need to collect your required equipment so that the process can be carried out smoothly.
Okay,
All right. And can you give me a list of the equipments, just whatever is in your mind?
It's I guess it's a syringe, and it could be alcohol, like swabs.
Good.
And
Anything else that you
no,
can?
I guess these I know.
Okay, this is enough at your level. So you need to get a syringe, as you said, and you need to get an alcohol swab, and then we need to get some subcutaneous injection needles. All right, and we will keep all of this stuff in the kidney tray. All right,
Okay.
and obviously you need a clinical waste bin to discard
All right.
this at the end of the procedure. All right. Okay, then to proceed further, to be on the safe side, before you proceed with the procedure, kindly always check about the allergies from the patient, and also check the drug chart.
All right.
Okay,
All right.
and not forget to confirm the name of the patient.
Okay.
All right. So am I clear so far?
Yes, 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 doctor.
Would you like me to repeat any of the steps?
No, doctor, thank you.
Or could you repeat
No,
the
no.
last steps for me?
Yeah, that we need to check patient's wristband, patient's like identification, drug chart.
Okay, great. Great. So, okay, after doing this, before you inject, you need to inspect the area, okay,
Okay.
where we are going to be inject. Can you name the common sites which we can use for the injection?
No, doctor. I guess it's on the shoulder, and other than that, I do not know much about this.
Okay, let me tell you. We can use we use the sites like the fat of the arm, okay, and the fat of the thigh, and
Okay.
you can also use abdomen just above your belly button,
Okay.
okay, and rarely we also use back just below your shoulder blades.
Okay. All right.
Okay, I hope I'm not going too fast,
No,
James.
yeah, it's fine, doctor.
Okay, so once you have selected your site, then you need to examine the site carefully so that there is not any inflammation or any scarring or any trauma, any recent trauma at that site. Okay.
All right.
Okay, and if there is any lumps or bumps, you also need to avoid that site. All right.
Okay.
Okay, and just a added tip, and just keep on continuously changing the sites of the injection so that there is no infection.
Okay. All right.
Okay, James, now I will be explaining to you the procedure. Okay, first of all, we need to clean the area from inside out. I will also show you this, okay? After cleaning, you need to pinch the skin between your thumb and index finger, all
Okay.
right, like this. And then you will pierce the skin like this by holding the needle as you're holding a pen at 45 degrees, right?
Okay. All right.
And please be careful that you need to warn the patient before pinching him with the syringe. All
All
right.
right. All right.
Can you be able to remember this? Okay, good. So you need to inject the contents slowly, and for that what you will do, you will count till 10, like 1, 2, 3, okay, and then slowly inject the contents along with. All right.
All right. All right.
And then apply the gauze and remove the needle.
Okay.
Okay. And please make sure that you do not need to aspirate the contents or rub the skin afterwards the injection. All right.
Okay. All right.
Could you tell me what would you do next after removing this needle?
That's done. We will thank the patient, I guess.
Yeah, we will surely thank the patient, but before that, we need to wind up our equipment. So for that, we will discard the needle in the shops, and we will also discard the remaining of the items like gloves, swabs in the clinical waste bin. All right,
Okay.
and most importantly, we will mark the injection site on your rotation chart.
All right. That's great.
All right, and then you need to do a little bit of documentation about the procedure and the injection and the site and the timings to be documented. All right.
All right, doctor.
Okay, and then post procedure, there are some of routine doings that as you already told, that you will thank the patient. You will inform him that you have given the medication completely,
Okay.
and please safety net the patient that it is fine, that the injection site might feel a little bit sore for 1 or 2 days.
Okay.
However, if it lasts greater than 48 hours, they need to inform us. All right.
All right.
Okay. So, is this memorable for you?
Yeah, sure, doctor. That was great. That was thorough, and I have understood each and every step of this supplement injection. Now I will do on my own. Thank you so much.
Okay, James, I will also give you, I will provide you with some leaflets, and you can get through those printable materials. And once you are done, if you have any concerns, you can come back to me. And first, you can observe these injections, then you can try giving them under supervision. And then once you are good to go yourself, you can do them independently. All right.
All right, doctor.
Okay, thank you so much, James.
Thank you. So it took more than